What if I told you that one of the most powerful tools for managing your blood sugar isn't sitting in a prescription bottle, but in something as simple and overlooked as when and how you drink water? I know that sounds almost too simple, and you're probably thinking, I've been drinking water my entire life. How could that possibly fix my numbers now? Or maybe you're skeptical because you've already tried it all. The supplements that didn't work, the diets that were impossible to maintain, and the advice that sounded good on paper but never translated into better A1C results. But stay with me, because what I'm about to share has made a genuine, measurable difference for hundreds of my patients right here in my practice. People who were doing everything right and yet were still struggling to find stability. My name is Dr. Grant Colby, and today I'm going to show you exactly how proper hydration timing can improve your insulin sensitivity by up to 40%. We aren't talking about hypothetical textbook cases. We're talking about real folks in their 60s and 70s who follow their meal plans religiously and walk every morning, yet still wake up to unpredictable spikes that leave them exhausted and worried. There is a specific strategic way to hydrate that most doctors never mention, and if you miss even one step, you could be accidentally sabotaging your progress. Watch until the very end, because the H3 method I'm revealing today might just be the missing piece to the puzzle you've been trying to solve for years. The frustration I witness in my clinic every day is both real and, frankly, heartbreaking. I see men and women in their 60s and 70s who have been fighting this battle for decades, and they are exhausted. These are people who take their medications faithfully, never missing a single dose, and follow meal plans so strictly they've given up almost every food they genuinely love. They spend a fortune on specialized diabetic foods, measure every portion to the gram, and check their blood sugar multiple times a day until their fingertips are sore. They do everything their doctors ask of them, and yet they still feel like they're failing. It's a heavy burden to carry when you're trying harder than anyone else around you, but your A1C results still come back like a punch to the gut. You feel the constant vigilance, the worry every time you see an unexplained spike, and that nagging fear about what the future holds. In my years of practice, I've learned that sometimes the most powerful medical interventions aren't the most complicated ones. Sometimes it's the basic foundations we've completely overlooked that create the biggest, measurable differences. We're going to fix that today by looking at what's really happening under the hood of your metabolism. But before we dive into the science of why your body's thirst alarm might be broken, take a moment to hit that subscribe button and turn on notifications. My goal is to help you stop feeling like a prisoner to your meter and start feeling like yourself again. And I don't want you to miss any of the life-changing strategies we share here every week. To truly understand why your blood sugar behaves so unpredictably, we have to look at what's happening inside your body as you cross the age of 60. Several significant physiological shifts occur that make glucose control feel like an uphill battle, even when you're doing everything right. First, your cells naturally become more resistant to insulin, meaning they don't respond as quickly when insulin tries to deliver energy. At the same time, your pancreas often stops producing insulin as efficiently as it once did, leaving you with less of this vital hormone to manage the load. Even your kidneys begin to struggle, allowing excess sugar to linger in your bloodstream longer rather than being eliminated. But here is the hidden factor that most healthcare providers completely overlook. Your brain's thirst mechanism becomes significantly less sensitive with age. This is absolutely critical because you can be dangerously dehydrated without ever feeling thirsty. At the cellular level, even a mild drop in hydration just 2% below optimal levels can raise your blood sugar by 10 to 15 points. That is often the sole reason behind those frustrating morning spikes or unexpected afternoon highs that seem to come out of nowhere. When your blood volume drops, your glucose becomes concentrated, and your insulin simply cannot work in such a thick, sluggish environment. Let me tell you about a patient of mine named Arthur. He's a 68-year-old retired engineer from Ohio, and I could see the sheer frustration written across his face before he even sat down in my office. "Dr. Colby," he said, his voice tight with emotion, "I don't understand what I'm doing wrong. I'm eating carefully and measuring every portion. I take my metformin exactly as prescribed, walk 3 miles every single morning, and I've completely cut out sugar and white bread." He pulled out a small notebook completely filled with blood sugar readings to prove his point. "Look, some mornings it's 145, other mornings it's 185. Yesterday morning was 162. This morning was 178. I eat the same steel-cut oatmeal every single day, but the numbers are all over the place." We methodically went through his entire routine. His diet was excellent, his medication timing was perfect, and his exercise was consistent. Then I asked a question that seemed almost trivial. "Arthur, walk me through your morning from the moment you wake up until breakfast." He explained that he'd wake up at 6:30, check his sugar, and drink black coffee while reading the news. He wouldn't have any actual water until he took his pills with breakfast at 7:30. There it was. Arthur was going nearly 10 hours without a single drop of water. We made one simple, strategic change. He started drinking warm water with a pinch of sea salt and lemon before his coffee. 2 weeks later, his morning readings stabilized between 125 and 138. No medication changes, just water timed correctly. He admitted he thought the idea was crazy at first, but he couldn't argue with the meter. Before I teach you the specific method that's helped my patients like Arthur achieve these results, let me explain the 3 most common hydration mistakes I see in my practice. You are almost certainly making at least one of these right now. Mistake number 1 is waiting until you're thirsty to drink. Thirst isn't an early warning system. It's an alarm bell that goes off only after you're already significantly dehydrated. By the time your mouth feels dry, your blood has already thickened, your glucose levels have elevated, and your insulin is struggling to work. Think of your blood like a river carrying glucose to your cells. When that river is full, everything flows smoothly. When it runs low, it becomes thick and sluggish glucose gets stuck in your bloodstream instead of being delivered for energy. Mistake number 2 is drinking large amounts all at once. Your body can only absorb about 1 cup every 15 minutes. If you chug a giant bottle to catch up, most of it just passes straight to your bladder without hydrating your cells. It's like dumping a bucket of water on a houseplant. The water just runs off the sides while the roots stay dry. Mistake number 3 is drinking ice-cold water, especially in the morning. Cold water causes your blood vessels to constrict, making it harder for insulin to reach your cells. Room temperature water keeps those vessels relaxed and dilated. If this information is helpful so far, please comment "good" below, or if you want me to share more tips like this, hit the like button to give me the motivation to create more videos on this topic. Now, let me teach you the specific protocol I use with my patients to fix these issues. I call it the H3 method. The H stands for hydration, and the 3 represents 3 critical timing points throughout your day that act as metabolic anchors. Timing point number 1 is first thing in the morning. This is arguably the most important moment of your entire day. From the second you wake up, before you touch your coffee, check your phone, or eat breakfast, you need to drink 1 full glass of warm water, roughly 12 ounces. After 8 hours of sleep, your body isn't just low on fluids, it has also lost essential electrolytes. By hydrating immediately, you signal your adrenal glands to calm down. This prevents the morning cortisol spike that usually instructs your liver to dump excess glucose into your bloodstream. The second timing point is 15 minutes before your major meals, specifically lunch and dinner. Drinking about 1 cup of water at this time prepares your digestive system and stimulates enzyme production. More importantly, it slightly dilutes the contents of your stomach, which slows down the rate at which carbohydrates are absorbed into your blood. This ensures that your blood sugar rises gently, rather than spiking aggressively after you eat. The third timing point is during any sustained physical activity. If you're gardening, walking the dog, or doing household chores for more than 20 minutes, you must take small, frequent sips, about 4 ounces every 15 minutes. This prevents the sudden blood volume fluctuations that often lead to those mystery sugar crashes or spikes during exertion. The temperature and composition of the water you drink are just as vital as the timing itself. In my practice, I always emphasize that for those over 60, room temperature or lukewarm water is non-negotiable. Cold water shocks your internal systems and causes peripheral vasoconstriction, which can temporarily impede the delivery of insulin to your muscle tissues. Warm water, conversely, encourages vasodilation, keeping your circulation fluid and your metabolic pathways open. But we need to go a step further than just plain tap water. When you wake up, I recommend adding a small pinch of high-quality sea salt and a squeeze of fresh lemon to your first glass. Why? Because as we age, our bodies lose the ability to retain essential minerals efficiently. Sea salt provides trace minerals like magnesium and potassium that act as electrical conductors, helping the water actually enter your cells rather than just sitting in your stomach. The lemon provides a hit of vitamin C and citric acid, which assists in alkalizing your body after a night of metabolic repair. Finally, for the evening, I often suggest my patients add a small amount of powdered magnesium to their last glass of water about an hour before bed. Magnesium is a natural insulin sensitizer and helps relax the nervous system, ensuring that the dawn phenomenon, that frustrating morning blood sugar spike, is kept under control. These simple additions turn ordinary hydration into a targeted medical strategy that supports your pancreas and protects your vascular health throughout the night. Many of my patients ask me, "Dr. Colby, exactly how much water do I need?" While the old 8 glasses a day rule is a decent starting point, it isn't precise enough for someone managing blood sugar over the age of 60. A more accurate formula I use in my clinic is to take your body weight in pounds and divide it by 2. That number is the total ounces of water you should aim for daily. For example, if you weigh 180 pounds, your target is 90 ounces. However, we must adjust this based on your activity level and the climate you live in. If you're active or it's a humid day in Florida, you'll need an extra 8 to 12 ounces to compensate for what's lost through perspiration. But how do you know if it's actually working? The simplest way to monitor your hydration status is by checking the color of your urine. You aren't looking for clear water that actually means you're flushing out too many minerals. Instead, you want a pale, straw-like yellow. If it's dark like apple juice, your blood is likely becoming too concentrated, which will inevitably lead to higher glucose readings. If you find this formula helpful and want to help others take control of their metabolic health, please hit the like button and share this video with a friend or family member who might be struggling. Spreading this simple knowledge can truly change someone's life. To see how these principles translate into real-world results, I want to share the story of another patient, Dorothy. At 74, Dorothy was at a breaking point. She had been living with type 2 diabetes for nearly 20 years, and despite her best efforts, her A1C had climbed to 8.6. Her doctor was preparing her for the likelihood of daily insulin injections, a prospect that terrified her and left her feeling like she had lost control over her own body. When she first came to see me, she was skeptical. She told me, "Dr. Colby, I'm already drinking tea and water all day. How is changing the timing going to stop me from needing insulin?" We sat down and implemented the H3 method, focusing specifically on her morning ritual and the 1 5-minute window before her meals. We replaced her ice-cold water with warm lemon water and added the trace minerals she had been missing. Within the first week, the morning spikes she had feared for years began to level off. For the first time in a decade, she saw a fasting number under 110, but the real breakthrough came 3 months later at her follow-up. Her A1C had dropped from 8.6 to 7.3. Her primary physician was so stunned by the progress that the conversation about starting insulin was completely taken off the table. Tears welled up in her eyes when she told me she finally felt safe in her own skin again. It wasn't just about the numbers on the meter, it was about the freedom from fear. Dorothy's success proves that your body still has an incredible capacity to heal and regulate itself, provided you give it the right foundational support at the right time. Now, I want to challenge you. Don't just take my word for it. Put the H3 method to the test starting tomorrow morning. For the next 14 days, commit to these 3 timing points and monitor how you feel. Pay attention to your energy levels, the clarity of your thinking, and most importantly, those numbers on your glucose meter. If you see a positive change, I'd love for you to come back and share your story in the comments. Your experience might be the exact inspiration someone else needs to take that first step toward better health. As always, remember that while I am a doctor, I am not your personal doctor. This information is for educational purposes and should not replace the tailored medical advice from your healthcare provider. Always consult with your physician before making significant changes to your routine, especially if you have kidney or heart conditions. Thank you so much for spending your time with me today and for taking your health seriously. If you found this video valuable, please subscribe to the channel and hit that notification bell. We have many more deep dives into metabolic health and senior wellness coming your way, and I don't want you to miss a single one. Small, strategic changes truly do create measurable results over time. Take care of yourself, and I'll see you in the next video.